today's video, we want to talk about how to use these antifungal medications to treat yeast effectively. How to use them, how to combine them, when to take them. Can you combine all of them? How many days do you need to take them? This was the highlight of my previous video comments. People keep asking about them. So it's very important that you understand how to take them well so you can treat your yeast infection very, very well. Because one of the reasons why your yeast infection keep coming back is because of improper, wrong, or incomplete treatment. Let's go to the board. Okay, the best medication we have for yeast infection is fluconazole, clotrimazole, miconazole. You remember? Now, how can I take them? The one you will take depends on how severe your infection is. If it's just simple, uncomplicated yeast infection that you have, please, you can go with topical cream, clotrimazole or miconazole cream. These ones are cream. You can go with them. You can apply the cream for 7 days every night. Every night for what? 7 days. This cream, if it's just simple, uncomplicated yeast infection, apply this cream, either clotrimazole cream or miconazole cream for 7 days. Now, if your yeast is moderate or seems to be severe, you will graduate to fluconazole oral tablets. You swallow it. You will get 150 milligram of this fluconazole from the pharmacist. Okay, when you get it, if you just moderate yeast, you can just swallow only one, just 150. Once is enough. Don't over treat yourself. Once is enough. Okay, now if you think it's moderate, I want to combine topical, as in the one you apply and the one you swallow. You can take fluconazole 1 plus this cream. So you would drink fluconazole through your mouth and apply either clotrimazole on your vulva for up to 7 days. Do you get it? If your yeast is now very, very, very severe, you will still take this fluconazole. Now, the treatment regimen will change. You take it once and take it again in the next 72 hours and again in the next 72 hours. Example, you take it on day 1, day 4, and day 7. Do you get? So, one dose, the first dose will be today. After 72 hours, you repeat the second dose. After the next 72 hours, you repeat the third dose. So you take it once every 72 hours times 3 doses. Do you understand? So this is the way to take this medication to treat your yeast very, very well. It's very important you understand something when you are taking this medication. Okay? You should not take this fluconazole tablet. If you are pregnant, hold your ear. You should not take this fluconazole tablet if you are pregnant. First announcement in your yard. Please don't try it if you are pregnant. Okay? You can only use topical one, the one you apply. Don't swallow something through your mouth for yeast during pregnancy. Another one is that during the time of this treatment, try and avoid knacking, because the more you knack, the more you get irritation. So to allow the symptom to settle down before you resume knacking. Then make sure you finish full course. This is the single reason why most people keep saying, I take the medication, right? I take the medication, yet my yeast is back. Because you're not finishing the course of the treatment. Make sure you finish the course of that treatment. Otherwise, it will come back. Then, this combination, avoid combining too much medication. You will combine this. Focus on one. If you combine too much, right? You know, this yeast, they react in different forms. So if you combine too much, it may not work well, because some of them might interact with each other. So minimize combination, right? Before you combine, make sure you verify from health personnel. It's very important. Then, if you want to combine, as I said before, you can combine fluconazole, which is oral, and topical, something like clotrimazole or miconazole. Topical one, the one you apply. Then remember that you must not combine. As I said before, it's not a must. You can just take topical. You can just only take the oral. That's it. Please, if you have questions, write it down in the comment section. Make this announcement in your yard. Spread this news, because a lot of women are still struggling with yeast infection. Thank you.